Welcome to Leaders and Legends, a show about the very best doctors in regenerative, orthopedics, and sports medicine. I'm your host, Dr. Charles Mall. My goal is to give you an in-depth look into the lives of the top experts in regenerative medicine, the doctors' doctors, who are globally recognized for their skill, compassionate care, and commitment to finding cures. These are the physicians who teach internationally and nationally, the ones I would trust with my own care, and the absolute best of the best. How did they get so good? What makes them tick? In each episode, I sit down one-on-one with these remarkable individuals to hear their unique stories. Whether you're looking for a few life lessons or you're a fellow physician hoping to pick up a clinical pearl or two, this show is for you. So sit back, relax, listen, watch, and enjoy. Thank you. I'm Dr. Mall. Today, I'm delighted and happy to have with me as my guest physician, Dr. Paul Lieber. Paul, it's a pleasure to see you again. Paul, I know you're a physician in Pittsburgh, Pennsylvania. You've been there many years. Did you grow up in Pittsburgh?
I did.
Okay, so you're a homeboy. You stayed there.
Well, I left for a while. I had gone to graduate school in New Hampshire. I tried to make the Olympic road racing bicycle team in 1976. And
That brings up the cyclist in you.
yes, I've been a cyclist forever. I raced back in the 70s. And again, in 2010, I raced for about 6 years at that point in time.
Does your wife share your passion for this?
Nobody shares my passion for this. She rides.
How old were you when you started off? 10 years old or younger?
I was probably 15, 16 and wanted to escape my family. And so I hopped on the bicycle and rode all around Pittsburgh.
And had your adventures.
Yes.
Mhm.
And then I bought a nice bike, and somebody said, well, you have a racing bike, you should be bicycle racing. So I did that. I wound up building bicycle racing frames for about 5 years with a colleague of mine.
Selling them all over Pittsburgh,
All
all
around
over the
Pittsburgh.
States.
Yeah.
Very nice. When did you find the bug to become a doctor? How did that come about?
Circuitously, he had gone to Antioch, New England
For a master's degree.
in counseling psychology.
Okay, yeah.
And
You
I
went to a great college, Hobart
Hobart
College.
College, Geneva, New York. I had graduated, and I wanted to either become a psychiatrist or get a PhD in psychology. And I had not taken science courses in undergrad. And so I decided that I would look at taking science courses with the intent to go to medical
This
school.
is even after you graduated college. You had to go back and restudy to fit the curriculum required for medical school.
That's right. So I did all of that in Boston at Brandeis University.
Gotcha.
And I wound up applying and going to medical school, Chicago Medical School.
I know that school. I was there several years before you. So I had instant liking to you when we met because of that bond. I went through Chicago Med in 3 years instead of 4,
Wow.
which was really tough. I didn't see a beach. We drive by the Lakeshore Drive in Chicago, and I'd go, what are those people doing on the beach? Because I had forgotten I was studying so hard in those days. And I don't think they have those programs anymore, 3-year programs.
I don't think so.
Yeah, it was too hard on us.
Yeah.
But anyway, so you went into medicine or graduated medical school. How did you pick the field of basically pain management, helping all these folks with pain?
Well, I went into physical medicine and rehabilitation, and I always gravitated towards outpatient musculoskeletal medicine and, treating peripheral joints and
Sure.
tendons and ligaments. And I wound up first going to practice in State College at a rehab hospital there. And I was, in addition to doing inpatient rehab, I did a lot of outpatient treatment. Came back to Pittsburgh 2 years later and have stayed ever since. And I wound up being a doctor in a workers' compensation network. Usually those folks are fairly heartless when you're working in insurance-based practice. But I was not that way. I felt that injured workers were a ticking time bomb. and you had to get them back to work quickly. And I found it to be tremendously difficult to get the people who I thought needed an epidural injection in their back to get treated in a timely manner through the system. So I said, I'm going to do it myself. And I went to took courses with some legends also, Joel and Jeff Saul, out at Stanford, and learned how to do this stuff. And then I was politically incorrect because I was a physiatrist doing this in an anesthesiology world. So I had to get permission in the hospital entity to be able to do that. That's how it all started back in 1995.
And you've had a knack for doing injections because you've injected my back and my sacroiliac joint successfully. And I know you're a member of the Regenix network of non-surgical orthopedic specialists throughout the United States. You're one of the original Regenix docs, and you're one of the top docs in Regenix too. So I've watched you work. You know your stuff well, and your patients benefit from your care all over the Pittsburgh area, right? Yeah.
Well, they're really all over. I mean, I've treated people from Europe and Canada and Israel, so it's been an expansive.
You have a knack for what I call not only the passion for medicine, but what I call patient-centric care. You love your patients, and people feel that when you work on them and help them.
I really do love my patients. Everyone is unique and special, and I feel very strongly about that. And I think that that keeps me passionate, and that enables me to continue to evolve and learn more so that I can help my patients more.
And I think that's why a lot of us tend to stay in medicine longer and longer, because if we can find that little niche that gives us the passion and satisfaction of the daily workload that we have, we'll stay in it forever and enjoy it. I find when doctors retire early, we have so much knowledge that we can share with younger docs or still in caring for patients and taking care of their life ills or improving the suffering that people have in pain, that we should continue doing something in medicine. So you're going to be like me. I'm going to keep going until I fall down.
Yeah, I have no real plan to retire. I've cut back some. I'm have the good fortune that I am a co-owner of my practice. There are actually three of us now, very egalitarian, and I can take the amount of vacation that I want and practice the amount that I want.
And let's ask this, going from your standard of care, physical medicine and rehab practice, you were one of the first docs that I know that got into the interventional regenerative orthopedic medicine aspect of PMR. And how did that kind of turn happen where you discovered prolotherapy and then the orthobiologics?
So in 95, I had taken these courses at Stanford with the Saul brothers, learned how to stick a needle on a lumbar spine. And I would stick cortisone in and prescribe physical therapy. And it just wasn't enough. I wasn't getting the results that I really wanted to. So I came to Hackett Hemwell course in 1998. And that was the beginning of my prolotherapy endeavor.
You did the 2 weeks in Honduras?
I did not. I didn't feel that I could take 2 weeks away from my
Yeah,
practice.
that's tough to
It
do.
was too much for me. So I quickly became involved with the AAOM. In 2002, I joined, and I never looked back.
It's terrific. You've
Yeah.
been a past president of this organization, Lifetime Achievement Award winner. So you've gone through all the trials that we go through in this organization, multiple medical missions to give back and teach the young docs. What would you say to a young doc coming out of training right now? What should he do?
I think it's important to be passionate. I think it's important to be patient centric. I think it's important to not rest on your laurels, to be willing to develop and grow along the process and continue to learn and take those things back to your practice. I've never centered myself on making money. I've always centered myself on trying to do what I think is right.
Right. You do things right and things will come as
That's
necessary.
That's what I believe.
That's what I was taught when I was younger.
And I think that those things are important. I think it's important to be humble. I think it's important to be honest. I think it's important to have a lot of
Things we pass on to our children.
Yeah.
The same values and morals and common decency and human dignity.
I have an approach to treatment when treatment goes wrong that it's always my fault until proven otherwise.
Oh, I'm the same way. I agree with that.
And if there's a problem, I will go to the end of the world to solve the problem. I feel that, people think that I'm unique in that it takes so much time that I am always looking and searching for the right answers, that I will call them at various times of the week to get in touch with them. And they think, man, you're just doing this for me. I do it for everybody. Every patient.
It's nice because we all want all of our patients to stop suffering. And I train my staff when patients walk in the door, number one, walking funny, they're grumpy, they're angry. And I tell my staff, they're not out for us being angry or grumpy. They're just hurting. Chronic pain. These people are hurting. So you got to cut them some slack. And that's our job, is to try and make them better. Give them. Some patients come in, they want a anesthetic shot every 2 hours,
Right.
because they want to be out of pain. So it's a rewarding feel when we get the results we want, and it's hurtful when we don't get the results or we can't get the results that we'd all like to have.
Right. Absolutely.
But what we're discovering now when we go to annual meetings and whatnot of our organization, that there's things out there now that may change the future of what we're doing. The orthobiologic medicines that we're using now, we've heard it this week, there'll be some new developments in the next 5-10 years that could hopefully change the management of pain.
Change is the only constant.
Change is the only constant. That's a great line. That's great.
And I do feel like this field continues to evolve.
Mhm.
For me, it's very exciting.
Yeah, I think the people of Pittsburgh are happy to have a doctor like you in the community, who's kind and caring, compassionate, and has the skill set, which is the major thing. You have the skill set to handle the difficult problems and the simple ones too, and care about all of them, no matter what it is. So that's great.
I'm excited by your being able to do this.
Well, I hope you'll come back to the show. We're just getting this started right now.
I'd be happy
So
to come
we're
back.
going to talk more and more. This is just the introductions of who you are,
Right.
because I want people to know you've helped me firsthand. You've helped me, and you can help a lot of people once we get the word out of what we do.
Thank you.
Paul, thank you for being here. This has been a pleasure. Real
Likewise.
pleasure. We'll have you take a cup home, okay? Thank you.
All right.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if